Hi, everyone. We're going to go ahead and get started with our next lecture, which is careers in medicine. So, sharing my screen and let's get started. So, with careers in medicine, first thing we want to understand is you can now major in kinesiology and get into the medical field where it used to not be that easy. Most of medical or pre-med majors they had a degree in biology or organic chemistry or something like that. But now we've made it a lot easier to get your pre-works completed for a medical program. So what we want to talk about here is just different opportunities in medicine, purposes, types of work that's done, and then, and most importantly, the educational requirements and experiences necessary to go into this field. So first, we want to ask, what actually is medicine? And we do know medicine has a different definition than rehabilitation, which we think back to our rehabilitation lecture that we had previously. And now we're kind of taking going down a different route where we're looking at patient care with managing diagnoses, prognosis of whatever that diagnosis was. We can also look into prevention and treatment. We would assess other things such as assess the injury, disease with technology or palpitation. And then obviously we're just really trying to promote their health. We know there's lots of different practices in medicine, but medical professionals also still kind of have the same goal as health and fitness professionals, rehabilitation specialists or therapeutic specialists, and that's to make sure that our patient, our client is healthy. We want to prevent any diseases, illnesses, injuries, and then provide a high quality of life for those individuals. All right, so let's look at some core competencies that medical professionals have to practice, follow. Obviously, we're providing patient care. We're working in teams. There's usually a team of doctors that has nurses in there, that has different doctors with different specialties treating a patient. We use evidence-based practice. This evidence-based practice is based in research. It's based in scientific studies that have been done on a certain treatment plan, on a certain device that they're using, etc. Quality improvement, and they use informatics. Informatics is just like data. So a lot of record keeping, a lot of data that they're pulling from, just like we talked about with that evidence-based practice. Informatics is just data information that they are using to treat individuals. All right, first we have a chiropractor. Chiropractors are doctors. They're just doctors of chiropractic care. They to adjust neuromuscular system. So mainly working with the spine, the pelvis. They use different adjustments to help to promote a positive alignment in the body. Assess posture, usually first thing, alignment. They manipulate the spine and other joints. And then they would create plans for you to come back to get extra manipulations done. They would also make sure that they've alleviated any pain, discomfort while using those non-invasive methods. It could be anything from like a massage gun to like these like these pinpoint clickers, to using manual adjustment with their hands. And they also usually have you do x-rays probably before you would even get your first adjustment to kind of look at the spinal alignment. And then there's some other diagnostic tests that they can run, thermal energy scans across the spine, and they're looking at the muscles attached to the spine. And they can look for tension in certain areas. Um, how do we become a chiropractor? So to become a chiropractor, first just a bachelor's degree, and then you would go to a doctor of chiropractic program. So you would apply for those programs after you graduate with your kinesiology related degree. And then there's a series of 4 board exams. And then you would apply for a license. So this is a licensed professional. And there's lots of different specializations, pediatrics, pregnancy, rehabilitation, animal chiropractic care, reflexology, neurology. So lots of different areas that you could go into. How much does a chiropractor make? So pretty good outcome, or sorry, outlook we see is 70 to 200K across the entire country. You can see the blue states in this graph have the higher pay. Salary ranges do vary based on your education, certifications, additional skills, numbers spent in the field. This YouTube link at the bottom is a really good link. It shows what exactly chiropractic care is, and it gets into the science of how someone adjusts your body. All right, next is a nurse. Nurse are pretty amazing because of all the things that they do for the patient, such as monitoring vital signs, administering medication, wound care, assisting patient with activities of daily living. They would obviously assess the patient first, figure out what's going on, record their medical data. Again, they work with a healthcare team to diagnose the patient, effectively manage medical equipment, treatment plans. They would also work with the families to come up with discharge care, like I said, post-hospital care education. Here's a YouTube video at the bottom about becoming a nurse. Let's look at some other education and credentials that's needed. So there's so many different types of nurses. One of the first types of nurse is just a certified nursing assistant. So this is just a short program, which could span several months to a few years, where you could get your diploma as a CNA. Another one is a licensed practical nurse, also a certificate, a diploma. It's a short schooling program, again, a few months to a few years. And then we have associate's bachelor's degree, which can get you to be a registered nurse. Most advanced programs, such as your advanced practice nurse, would be a master's degree. You could also become a nurse midwife after having a master's degree. You've probably heard of a nurse practitioner or a nurse anesthetist. Those would have to have a doctor's degree in nursing. There are 40 different types of nurses, so many different specialties. You can just read some of them at the bottom, such as an ER nurse, a trauma nurse, OR nurse, dermatology, critical care, acute care, plastics, psychiatry, travel nurses, so many different types. And so it's really important if you want to go into nursing to look into see exactly what type of nurse specialty you want to pursue. Nurses also have a lot of different places where they are needed, anywhere from hospitals, medical office. Think of the school nurse that you saw, military bases, government offices, nonprofit centers. So the kind of opportunities are endless when becoming a nurse. So how do we become a nurse? Obviously, you need your degree. Figure out what nurse you need to be. If you just want to do a short program or a longer program, obtain your license, pass your NCLEX exam, obtain employment, specialty, additional training, and then boards. Nurse salaries are high depending on which type of nurse you go into. Your basic nurses with just your diploma, your certificate, don't make as much as when we have a master's degree, such as our nurse midwife, a nurse practitioner, a nurse anesthetist. So obviously these numbers will get larger and larger. The more training you have and the more education you have. And there's always job growth for nurses. Next, we have a PA. So a physician's assistant or a physician's associate. They work very closely with the doctor. They do a lot of what the nurse does, but on kind of a more glorified level, and working more closely with the physician than the nurse would. So you can kind of read through and see all the different things that a physician assistant would do. And then you can click this link here at the bottom and look at video of becoming a physician's assistant or a PA. There's also lots of different specialties where PAs are needed. So just think of like your family medicine clinic, think of like urgent care offices, think of surgery, obstetrics, dermatology, etc. How to become a physician's assistant, bachelor's, gain work experience, do some shadowing, make sure this is the actual field that you want to go into. After spending some time shadowing a PA, figure out if this is a program that you want to go down. We see that it's just a master's program, 2 to 3 years, and then you would pass your certifying exam, apply for a license, pursue a specialty. We also see high salaries for physician's assistants. 50th percentile is 90K all the way up to 125. We also see a greater outlook actually for PAs than we do for nurses. Last is looking at doctor or physician. So first we have to understand the difference between allopathy and osteopathy. So you've probably heard of an MD, but have you heard of a DO? Possibly. They are both doctors, but they treat patients differently. And they also have their different schools. So we MDs, which is a medical doctor, learns allopathy. They treat and diagnose using conventional mainstream medicine, everything from x-rays to drugs to surgery. So this is your conventional mainstream medicine, whereas DOs, doctors of osteopathic medicine or doctors of osteopathy, they focus on holistic health and prevention. They use a system of physical manipulations, adjustments to diagnose and treat people. So osteopathy is the more holistic route. Allopathy is the more traditional mainstream route. So doesn't matter which one you're trying to become, they do have lots of different job requirements. So first is giving counseling patients on lifestyle, also examining patients, prescribing medications, interpreting diagnostic tests, keeping medical histories. Again, they work closely with the nurse, with the physician's assistant to provide care to the patient. So bachelor's degree, 4 years, you take your MCAT exam and try to get into medical school. Medical school is 4 years, and you would pass some other exams, and then get into your residency program, which is also 4 years. You would specialize and then pass your board certification in whatever that specialty is. And then most doctors, physicians would do a follow-up fellowship. This fellowship is even more specialized, another 2 to 4 years or so. And all the different there's so many different specialties out there that you can figure out which one is right for you. Here's kind of a list of all those different specialties. And you can also see pay associated with those specialties. These numbers are a little older, and they're constantly changing depending on what part of the country you're in. Job growth is high. Physicians, doctors, are always needed. Here's a YouTube link at the bottom to kind of understand more about what it is to become a physician, to become a doctor. Lastly, let's look at trends in medicine. Trends in medicine is really cool, because they're constantly learning new techniques and new ways to treat patients due to advances in technology and AI. So diverse delivery methods such as telehealth, which was available during COVID and it's continued, evolution of payment systems, also focusing on disease prediction, so predicting diseases and trying to prevent them before they actually spread. AI and patient decision making. So basically helping the patient to figure out, or helping the physicians figure out how to treat the patient. Improve surgery robotics. There are some minimally invasive surgeries that are already done with robotics. A lot of surgeries, what am I saying? Orthopedic surgeries. So like knee replacements, any type of surgery like that, ACL replacements or reconstructions are done with robotics anyway. But now it's becoming more advanced and they're able to do more procedures this way. And then increase in subspecialties. So lots of different trends and they will keep coming. But that's it. That's all I have for our medical lecture, careers in medicine. I do suggest watching those videos, especially if you are interested in going into one of those fields, and spend some more time looking kind of through the requirements that are on each of those slides that will help you if this is the right path for you. Okay, great. We'll talk to you next time.